Let's clear something right off the bat. If you have habits like biting your nails or thinking negative thoughts, you do not have obsessive compulsive disorder. Well, these are just normal bad habits. Now let's talk about OCD and get ready to learn some really difficult word to pronounce. OCD has two things: obsessions and compulsions. It is a disorder that causes repeated unwanted thoughts or sensation, which is obsessions, or the urge to do something over and over again, and that is compulsions. Some people can have both obsessions and compulsions. An obsessive thought might be that certain numbers or colors are good or bad. A compulsive habit might be to wash your hands 7 times after touching something that could be dirty. Although you may not want to think or do these things, you feel powerless to stop. Everyone has habits or thoughts that repeat sometimes. People with OCD have thoughts or actions that take up at least an hour a day, are beyond your control, aren't enjoyable, interfere with work, your social life, or another part of life. OCD comes in many forms, but most cases fall into at least one of 4 general categories: cleaning and contamination. In this type, you might feel a fear of things that might be dirty or a compulsion to clean. Mental contamination involves feeling like you have been treated like dirt. Symmetry and ordering. In this type, people have urges and feel intense need to have things lined up in a certain and specific way. Forbidden, harmful, or taboo thoughts and impulses like an obsession with a line of thought. Some of these thoughts might be violent or disturbing, hoarding and checking. It's when you feel strong need to collect or keep certain items relates to obsessions or compulsion, such as locks, alarm systems, ovens, or light switches, or thinking you have a medical condition. Now let's talk about how can we find out if we or anyone we know has OCD, which means OCD Diagnosis. Now most of time when we think we or somebody we know has OCD, it's just bad behavior or bad habits. But if you think things are going out of hand and the habits or repetitive behavior is compromising your quality of life, then my friend, you need to see a doctor. Your doctor may do a physical exam and some blood tests to find out what is the problem and make sure something else isn't causing your symptoms. They will also talk with you about your feelings, thoughts and habits, which is a very crucial part. Once diagnosed comes the question how we can treat or cure this. Treatment. Though there's no certain cure for OCD, however, it does not mean you can't manage or control it. Through some proper treatments, you may be able to manage how your symptoms affect your life through medicine, therapy, or a combination of treatments. Treatments include psychotherapy,
neuromodulation,
relaxation, medication, and TMS, which stands for These are the ones I was talking about earlier on, the ones difficult to pronounce. Well, transcranial magnetic stimulation, psychotherapy. Cognitive behavioral therapy can help change your thinking patterns in a form called exposure and response prevention. Your doctor will put you in a situation designed to create anxiety or set off compulsions. You learn to listen and then stop your OCD thoughts or actions. Relaxation. Simple things like meditation, yoga, and massage can help with stressful OCD symptoms. Medication. Psychiatric drugs called selective serotonin reuptake inhibitors help many people control obsessions and compulsions. They might take 2 to 4 months to start working. Common one includes, no, not going to fall for this time. Names are on the screen. If you still have symptoms, your doctor might give you antipsychotic drugs, like names are on the screen. Neuromodulation. In rare cases, when therapy and medication aren't making enough of a difference, your doctor might talk to you about devices that change the electrical activity in a certain area of your brain. One kind, transcranial magnetic stimulation, is FDA approved for OCD treatment. It uses magnetic fields to stimulate nerve cells. A more complicated procedure, deep brain stimulation, use electrodes that are implanted in your head. TMS, transcranial magnetic stimulation, The TMS unit is a non-invasive device that is held above the head to induce the magnetic field. It targets a specific part of the brain that regulates OCD symptoms. There are some separate conditions that are similar to OCD. They involve obsessions with things like your looks, body dysmorphic disorder, collecting, arranging, or altering things, hoarding disorder, pulling out, eating your hair, trichotillomania, picking at your skin, excoriation, physical illness, which is called hypochondriasis, body odor or how you smell, olfactory reference syndrome. I think I got this one right. Okay, there you go. This is it for today.